Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Khan, 870th episode. And now let's go to the headlines of the day. Women's health research is hugely underfunded when compared to spending on conditions that affect men, according to a new analysis of data from US National Institutes of Health, that is NIH. As per the WHO statistics, almost 800 women die from preventable causes related to pregnancy and childbirth. 76th World Health Assembly is taking place this week, that is from 21st to 30th May in Geneva, Switzerland, wherein WHO's global strategy will provide countries with a roadmap to end preventable maternal, newborn, and child deaths, including stillbirths, by 2030, as well as to improve their overall health and well being. The Weber Shandwick Collective today announced the launch of its bespoke cross market offering committed to shaping healthier futures for all women in Asia Pacific. As per a research report by Market Research Future, the women's health app market is projected to witness significant growth in the coming years and is expected to reach around US 17.87 billion by 2032, with a compound annual growth rate of about 17.88%. Now let's go to the topic of the day. Today we shall be talking about The topic today is asthma in pregnancy, and to tell us about this, we have Professor Dr. Jay Lakshmi TK. Let me introduce her to you. Welcome, ma'am. We are pleased to introduce Professor Dr. Jay Lakshmi TK, an esteemed medical professional with an impressive background and extensive expertise in the field of medicine. Dr. Jay Lakshmi serves as a consultant at Apollo Hospital, Mumbai, where her commitment to patient care and dedication to advancing medical knowledge have earned her a stellar reputation. In addition to her clinical practice, Dr. Jayalakshmi is actively involved in research and academics, contributing to the advancement of medical knowledge and the training of future healthcare professionals. Her endeavors have earned her a coveted array of awards and accolades, a testament to her unwavering commitment and profound contribution. Today, she will be talking to us about asthma in pregnancy. So, welcome, ma'am. Shall we start? Can you hear me, Dr. Jaya?
Production and thank you. I just invited. I'd be happy to talk about asthma. So, questions, will I something?
So, let me start with the first question. What is the impact of asthma on pregnancy, and how does it affect both the mother and the baby?
Yeah, so this is very one of the asthma is quite common in our country. Allergy or atopy itself affects about 10% of the population, and of these atopics, about 1% will have proper asthma symptoms. So, asthma is very prevalent, and asthma requires that patient need to take regular medication, that is the inhaled steroids or oral medications. And many times we find that pregnant females especially hesitate to use their medicine. It is quite common, and asthma can affect even during pregnancy. It can get worsened. Some patients can develop asthma during pregnancy itself. Some patients can have a pre-existing asthma which can be worsened because of the pregnancy, and it can also have undesirable effect on the outcome. But provided the patient takes the medications regularly, these undesirable outcomes can be well prevented, and the medications are safe. So this is what is the main message which I would like to convey, that asthma medicines are safe in pregnancy, and untreated asthma can have a lot of harmful effects on the
So, are pregnant women with asthma who do not take treatment at a higher risk of complications during pregnancy and child health?
Yeah, definitely. So, asthma, depending on its severity, can affect the health of the mother as well as the child. It can cause problems like low birth weight baby, preterm pregnancy, eclampsia, pre-eclampsia symptoms, premature delivery, abortions. These can all be caused because of asthma. And treatment of asthma can have a significant benefit in improving these outcomes and improving the condition of the patient. And as it is, pregnancy itself can cause breathlessness. So there is a physiological dyspnea which patients experience because of the progesterone surge during the first trimester and second trimester of pregnancy. And this physiological dyspnea further worsens the asthma symptoms. Also, because of the pressure on the diaphragm, the lung capacity also reduces, and that can also worsen the asthmatic symptoms in patients.
So, what are the changes that have to be made in the medication for a pregnant patient?
So the most interesting part or the hard part is that there is no need for making any changes in the treatment. The treatment for asthma is safe for pregnant females as well as for non-pregnant females. So females need not be scared that now that they are pregnant, that they will have to stop the asthma medicines, or did the asthma medicine harm my baby. If at all there is some warning for montelukast in the first trimester, antiallergics, steroids, bronchodilators, terjalin, formoterol, the salbutamol, all these medicines, inhalers are safe for asthma. Even anti-allergic medications like the nasal sprays, they are also safe in the treatment of asthma. Studies have been done in medications like terbutaline, salbutamol, fexofenadine, and they have been found to be safe. Even montelukast has not been found to really have any adverse effects in patients with asthma. Even
So,
steroids. So oral steroids,
okay.
injectable steroids, inhaled steroids, all three are safe.
So, the potential risks are not there with any medication of asthma during pregnancy, but can we monitor and explain to the patient that these are specific things which can trigger an asthmatic attack in her, which are different during the pregnancy times?
Yes, definitely. So our approach to treatment of asthma is similar in pregnant and non-pregnant females. So what we do is, first you diagnose the asthma. We can do a lung function test that is also safe in pregnancy. We can do a lung function test, and also do an IgE test is what we do. A total serum IgE immunoglobulin will give us an idea of the total immunity or hypersensitivity in the patient. That is the sensitization in the patient or the allergic tendency of the patient. We can also do specific allergy testing, which can be a skin prick testing or which can be a blood testing. But generally avoided skin prick testing in asthmatic individuals. We tend to ask them the history of whether there is any exposure to pets, any exposure to pollen, exposure to dust, any exposure to chemicals. So these have to be avoided. Also, the patient's history regarding which food is triggering off any asthma symptom is also very important, because more than any test, it is the patient's history. Like if the patient says on eating nuts, I get a chest tightness, or on eating pan, or on eating any type of fruit, or on eating banana. It's not that all have to avoid banana or kiwi. So people feel that no, yeah, I'm asthmatic, so I should not eat banana. But banana doesn't trigger asthma in most of the patients, only in some small subset. Similarly, patient feel that I should not have curd. because I have asthma. But curd doesn't trigger asthma in most of the patients. Some patients get triggered by milk, by curd, by wheat, by certain foodstuffs, nuts, fish, these type of prawns. So these type, but the patient's history is very important in this. So allergen avoidance is one of the very important things which an asthmatic female can do, dust avoidance. And we do a urine test to confirm the severity of the asthma. We usually avoid doing an x-ray chest in the first trimester. Anyway, in asthma, chest x-rays is normal and it is a secondary investigation, and it is mainly to rule out whether the patient has any other problem like tuberculosis or pneumonia or anything else, any other cause of cough. Mainly in asthma, we get a normal chest x-ray. So basically, we do the CBC to see for eosinophilia, we see the IgE level, we see the lung function test, we do past allergen history. Usually, we'll avoid the allergen testing, skin testing asthmaticals in pregnant females. So, and we will start the medication.
So, the common question these days is that are there any natural remedies or alternate therapies that can help alleviate these symptoms of asthma during pregnancy?
So, yeah. So, what I found is that this allergen avoidance, dust avoidance, using a air purifier in the room, keeping the room dust free, that helps a lot. Wearing a mask while going out or in dusty places, that also helps. Another thing what can help is if patients have an allergic rhinitis or a nasal stuffiness or block, they can use this gel neti, which can clean out the nose. But they need to use it properly and they need to learn it properly from a trained yoga practitioner so that they don't end up aspirating the water or causing sinusitis in the process. So if they do it properly, it's very useful. It helps to prevent asthma exacerbations in patients with allergic rhinitis.
So, also, some patients want to know that because of pregnancy in the second or third trimester, as the baby is increasing in size, asthma symptoms can worsen, or because of the hormones, they can get better during pregnancy.
Some patients' asthma does get better during pregnancy. Also, some patients do have a worsening symptoms during pregnancy. So it is unpredictable how it goes.
Okay. So, is it the
So we
next
get
question
many
that they?
references from our gynecologist colleagues.
Yes, ma'am.
So we do get many references from our gynecologist colleagues, especially now because there was a spate of upper respiratory tract infection, and most of the patients were having a lot of cough and the asthma was getting triggered off by the upper respiratory infection. So the treatment would remain more or less the same. Sometimes we may have to add a antibiotic or an antiviral treatment to that. But I would advise the patients in not to have too much of exposure in the community, not to go in crowds or in functions where there are a lot of people and where there is a tendency to get an respiratory infection which can trigger off or worsen the asthma symptoms.
Now, certain people they want to know, is it safe for a pregnant woman with asthma to exercise, and are there any specific guidelines they should follow while exercising?
So for the asthma as such, they can do exercise provided they are not getting too breathless or the oxygen saturation is not falling. We would advise to avoid exercises where there is a lot of hyperventilation. That is, so people who do yoga, we advise them to avoid the Kapalbhati part of it. The remaining, all the slow yoga techniques can be practiced. Even the normal walking, swimming, everything is okay. But too much vigorous exercises which can trigger off hyperventilation can be avoided for asthma. And I suppose pregnancy that's the mother to avoid that type of exercise.
Okay. And how often should pregnant women with asthma visit their healthcare provider for checkups and monitoring?
So it depends on the symptoms. If they are not actively symptomatic, they could just visit once in 3 months or so. If they are actively symptomatic, it's better to follow up every month just to see whether any medication need to be upgraded or downgraded or any worsening is happening to pick it up in the early stages.
And any dietary recommendations for these women to help them manage their symptoms?
Dietary recommendations, vitamin D is recommended, supplementation. Anyway, for I think pregnancy, they would be
Yes,
supplementing
otherwise
vitamin
also.
D supplement. Vitamin D supplement helps in prevention of transmission of the asthma to the babies as well. So it generally is known to be helpful. So vitamin D3 supplementations have been known to be helpful. Otherwise, they should have a good diet, nutritious diet as per requirement of pregnancy, and avoid any potential allergens which they know is they are allergic to. And also they should avoid junk foods and also packaged foods which have a lot of additives. Ice creams, colas, all these things have a lot of additives which can trigger off asthma, and these should be avoided.
So, what warning symptoms should we tell these pregnant women to watch out for? If they have any of these, they should rush immediately to a medical facility.
So usually with asthma, the oxygen saturation will never decrease. Even if you're hyperventilating, the oxygen saturation will be maintained. So if there is any fall in the oxygen saturation or too much fast breathing, too much of wheezing, tiredness, lethargy, sleepiness, excessive sleepiness, fall in the blood pressure, all these things should make the patient alert that this may be a more severe asthma attack. It's also useful to have something called as a breathometer or a peak flow meter at home. So that can, with the help of the peak flow meter, you can monitor the asthma. So this is what a breathometer would look like, no? So you can just blow on one end, and you will get the reading on the reading of the peak flow. So this is what you will have the readings on the breathometer, and with that you can come to know whether normally it would be around 400 or so, and if it falls to less than 200 or less than 50% of the normal, then you can be alerted that it's a severe asthma. Apart from that, it is a symptoms: fall in oxygen saturation, excessive wheezing, tiredness, low blood pressure. All these things will trigger a visit to the emergency.
Okay. And another thing that they want to know is that while breastfeeding, is it safe to take these medications? Will it affect the amount of milk, or will these medications pass to the baby and affect the baby?
Most of, yeah, most of the medications would pass through to the baby, but will be in a very tiny dose, and it will not cause any harm to the baby as such. So even breastfeeding can be safely done, and it will not cause any problem to the baby as such. The important thing is that the mother should be well. So that is the first thing.
That is the bottom line. If the mother is well, the baby will naturally be well. So, are there
Yeah.
any long are there any long-term effects of these medications on the baby's health, I mean to say?
So for the mother, for the baby, no, not for the baby, not the transmitted one. The dose is too tiny in the transmitted mother's milk to have any effect on the baby as such. For the mother, if there is a long-term inhaled steroids or long-term medication, oral steroids is going on. So oral steroids we don't normally give for asthma for long period of time. Usually we'll give it for 5 to 7 days only in the exacerbation. Those don't have any long-term side effect. But if the asthma is very, very severe and patient is on long-term steroid oral medication as well, that can cause effect on the bones, bone weakness, thinning of hair, thinning of skin, diabetes, these kind of side effect. But usually it is not common in asthmatic patient because they are not on oral steroid usually for a long period of time.
So, can smoking by the mother, or passive smoking, in case the father or the people living in the house are smoking, can this smoke impact asthma symptoms during pregnancy?
Yes, definitely. Smoking can impact asthmatic symptoms and can make the symptoms worse because smoke itself contains particulate matter, tar, and other ingredients ingredients which trigger of irritability in the airway mucosa, in the nasal mucosa, and it can make the asthma symptoms.
So, can stress or anxiety during pregnancy worsen these asthma symptoms?
Yes, definitely. I'm very glad you brought up this question. So, stress is one of the major triggering factors for asthma, and asthmatic ladies should try their best to have a more comfortable lifestyle, to have plenty of rest, to do some walking, yoga, meditation, some relaxation technique by which they can relax and avoid undue stress as much as possible. Get enough sleep, so getting enough sleep, reducing the stress, getting regular exercise, regular meals timing, all these things will go a long way in reducing the stress and reducing the asthma triggering.
So, like we all know, all the major cities of India are really polluted, especially during the winter timings, and Delhi, tops the lot. So, can this environmental factors like pollution, can they worsen the asthma symptoms? And like you told, at home you keep air purifier, but while going out, how to protect yourself
No,
from
definitely.
all this pollution and
No, definitely
asthma.
this definitely pollution has a major effect. Like many of my patients, they tell whenever they go to village or whenever they go even abroad, even though it's a cold country, they will have much reduction in their symptoms. They will not even need to use the inhalers. They can insert into the lungs, or and we have to try think of means by which we can reduce the pollution itself. We can try to stay indoors in pregnancy as much as possible, use air purifier, wear a mask while going out, avoid crowded or dusty places. But everything can be done only to certain extent. After all, the pollution is prevalent and it is everywhere. It's quite difficult to avoid for a pregnant person. So there is less that we can do at individual level. A lot more needs to be done.
So, are there any additional resources or support groups or networks which can available for these pregnant women, which can help them during asthma?
I'm sure there are support groups on the net, but what we tell our patients is to contact the emergency medical provider, or to come to the emergency department at the slightest, or to have regular outpatient. Uh, there, I'm not aware of the support groups as such, but probably there might be support group, but I'm not part of any of these online support groups.
So, madam, like if supposing a patient has a severe attack of asthma during pregnancy and there's severe spasm, and as you know, they breathe with difficulty in drawing of muscles, it's very scary for the family. Do you tell the family or the patient of some immediate measures to take before they can reach a hospital?
So the immediate measure is to use the inhaler. So we always advise them on which inhaler. Nowadays, the inhalers which are there are we call it as a smart therapy. So it has a short acting effect, immediate effect, as well as a longer acting effect. Or else they will take the short acting drugs like salbutamol or terbutaline. Two puffs, 4 puffs, 6 puffs also can be taken in emergency, or even a nebulization can be taken. So most of the severe asthmatic patients will have the inhaler with them surely, and they may also have the nebulization, which they can first take before they come to the hospital itself.
Okay, so that will kind of relieve their symptoms so that
We will give them
acute
the
panic
emergency
will be
ambulance
gone.
numbers.
Okay, that's
Yeah,
good. That's good.
yeah, yes, yes. The inhalers will usually have an effect on the acute condition as well.
So the panic effect will be gone. Any take home message you have for our
Yeah.
audience in whom, in whose family
My
or they
main take home
themselves
message is
are.
that, yeah, yeah, yeah. The main take home message is that asthma drugs are safe. Please don't stop your treatment of asthma because you are pregnant, because that is what leads to severe attacks, and ultimately, too much of the doses of the drugs have to be given in after admitting, and you have the opposite effect than what you intended. So, asthma medications are safe. Continue the treatment even during pregnancy, and consult your doctor before deciding to stop any medication or change any medication.
There is one question,
You don't
last
have to
question after
suffer.
your take home message. Okay.
Yes.
There
Okay.
is one question. They want to know ki, can we switch to Ayurvedic medicine and take only SOS inhalers and this nebulizer, and for regular treatment take Ayurvedic
For
medicine
the
during
asthma
pregnancy?
per se, no, I wouldn't advise that, because Ayurvedic medicines are good, but there are several, we don't know many things. Sometimes there are steroids, because steroid is a herb, it's grown on plants, it's grown on mountains. So it's very easy to get it because it's not herbs, it's a plant. So, because of that, advise medicine mainly in pregnancy, because we don't know what all are the ingredients. It will be better to stick to the safer inhalers, which have really very low dose of medication and which are known to be safe in pregnancy. So that would be my suggestion.
Thank you. Thank you so much. You've told us so much today about asthma and relieved so much of stress that people carry about asthma while they are pregnant. Thank you, Dr. Jayalakshmi, for joining us today. Could you show us the certificate, please?
Thank you. What
I'm
certificate?
sure many pregnant women. This is, ma'am, as a thanks to you from KK Med
Acha, okay.
Talks, and and many a patient and their families, patients who have asthma and are pregnant, and their families will sleep comfortably tonight because you have cleared so many doubts about asthma in pregnancy today. Thank you. That will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.